Good morning, everyone. My name is Judy Mueller with Healthcare Interactive. This morning we're going to be talking about Habeo Health. I'm hoping all of you can see the screen clearly, and I will have some help forwarding the slides. Habeo Health, designed by Healthcare Interactive, is a level-funded health plan anchored by a primary care home healthcare delivery model. Habeo Health was developed in collaboration with the Greater Baltimore Medical Center, a health system that you likely are familiar with, serving the Baltimore metro area, as well as Group Benefit Services, a national TPA located in Hunt Valley, Maryland. Habeo Health brings together the health system, its providers, and small to mid-size employers to offer a member-centric health plan and services model. Habeo Health is really, without sounding too lofty, is really on the verge of changing healthcare. It's a provider-directed health plan, which really is structured to heal the long-standing divide that has been evident between the payers and the providers. The next slide talks about what Habeo is. Habeo Health offers a unique integration of all of the components of a fully integrated health plan and more, accessing best-in-class services from each of the partners and integrating them into one unique healthcare delivery and benefits administration model. Habeo is structured to provide the optimum healthcare and benefits management experience both for the members as well as the employers, with a focus on mitigating risk and reducing overall healthcare costs. The opportunity to achieve these goals is highly driven by the integration of the primary care medical home panel of services into our wellness program. It's not about limiting care or a sole focus on treating existing illness, although we absolutely want patients to have access to the best care and services available. Rather, Habeo focuses on members building a close patient-physician relationship for the primary purpose of health management, with ample access to primary care, specialty and ancillary care, hospital care, along with a wide array of wellness programs and services. Primary care providers lead a holistic care team that helps patients reach both clinical stability and lifestyle goals. Employers gain an added layer of risk protection through embedded stop-loss coverage and a level-funded arrangement that results in flat monthly costs regardless of potential claims increases. If overall claims are less than expected, the employer shares in the annual savings, and that is our goal in working together. Primary care physician providers are under a direct contract with the employer as opposed to having their services accessed through a carrier relationship. All in all, Habeo is a health plan that clearly supports a win-win-win situation for all the stakeholders. The next slide speaks to why employers need Habeo. There are three primary reasons that you guys are all very familiar with: rising healthcare costs, difficulty in accessing actionable information, and lack of employee engagement with embedded wellness programs. Habeo's level-funded plan structure addresses the inevitability of rising healthcare costs under a traditional fully insured fee-for-service model, as well as the potential expenses expected due to ACA mandates. All the data is warehoused and managed in a single source solution that we call HealthSpace. It ensures access to actionable data as well as reporting and provides connected technology for the care providers, the payers, and the members. Incentives management and proactive patient outreach is built into the health plan to support meaningful member engagement. The member portal offers easy, user-friendly access to multiple tools and resources, including member-specific claim data, screening data, and incentives in order to keep the member engaged and focused on achieving their personal health goals. Care teams led by the primary care physician provide the holistic support, care, and clinical guidance to help patients stay as healthy as possible. The paradigm shift from managing diseases to managing health was recently articulated really well by Dr. John Chazar, who is the president and CEO of GBMC. He said in a recent presentation, and I quote, "While we want everyone to receive the high-quality medical care they need and deserve, the end game should really be health." And that philosophy has really been transferred to the primary care GBMC panel of physicians. That's PCMH's philosophy, and that's the focus of the Habeo Health Plan. The next slide speaks to the target market. The ideal target market is small to mid-sized groups of 20 to 300 employee lives. Groups can either be fully insured, reaping the biggest impact from the migration to a self-funded environment, or already self-funded, looking for a better system of healthcare delivery and benefits administration. It's recommended for maximum impact that 80% of the employees work or reside within the GBMC services area. Of note are some advantages for the small group market to renew before 1/1/16, advantages that, again, you are all very familiar with. Insurers are going to set rates using a single risk pool that includes all enrollees across their small group plans in the state. In 2016, the provisions will apply for businesses with 51 to 100 employees. According to a recent analysis done by the Blue Cross Blue Shield Foundation, an estimated 64% of members in groups with 51 to 100 employees could get as much as an average of an 18% increase in premiums. Because there be a different rate for each member of the plan, member-level billing becomes more complicated and could be administratively burdensome. Habeo's level-funded primary care medical plan solution and value-driven plan designs, and I'll talk more about that in a moment, are structured to address and mitigate those issues. The next slide speaks to financial benefits. As opposed to a traditional fully insured model, employers can expect to realize a reduction of 10 to 20% in their medical costs, as well as additional savings coming from a PCP-led care management, wellness initiatives, and population health programming. The level-funded model simplifies administration and cash flow issues, even if there are claims fluctuations. Excess claims funds are shared by the employer at the run-out of the contract. Basically, the primary care costs are all covered under that contract. I wanted to share with you in the next slide just an example of a client case study that really shows the cost impact for a group moving from a fully insured environment to a level-funded plan. This happens to be a 155 life group that experienced a 40% reduction in costs over a 2-year period. Not only were the annual premiums reduced for both company and the employees, but the integration of data mining and analytics drove further savings and healthcare outcomes, which was in part due to the integration of the wellness programming. In the next slide, we're going to talk a bit about the networks that are available through the primary care medical plan, Habeo Health. The network access is actually tiered. The core network is GBMC's primary care medical home network. Tier 2 is GBMC's full provider network of specialists and ancillary providers. And Tier 3 is a wrap network provided through PHCS. I'm really happy to share with you that 7 of GBMC's primary care medical homes have already been Level 3 certified, which is the highest level of quality awarded by NCQA. The next slide talks a bit about the member experience in working with a primary care medical home. The service centers offer unparalleled access to primary care services and the clinical teams that are a part of the model. There are no wait times. There are extended hours into evening and the weekends. And there is the ability to have some standard procedures done right in the primary care office as opposed to having to be referred out to yet another physician. The primary care medical home model is holistic, providing the members not only unlimited access to primary care services, but they also get the benefit of working with the internal and external care teams for support, for follow-up, and for personalized one-to-one health coaching. The data on the next slide, there's a view of the amounts of data that can be accessed through the HealthSpace platform. All of the data is captured and integrated into HealthSpace. And so when we have the opportunity to put all of the data sets into one data warehouse, if you will, the integration allows us to provide very robust analytics and reporting so that we can look at not only a view of the individual patient's health status, but also provide a view for the employer of the aggregate group as well. Sophisticated predictive modeling identifies risk at the very earliest levels, resulting in proactive opportunities to mitigate the risk and connect a provider with a patient before the issues get out of control. Primary care medical plan clinical care managers and their HCI RN colleagues, which we call nurse extenders, can collaborate together through the system to fully manage a patient from both a clinical conditions perspective as well as wellness. Data is also used to develop targeted population-based health programs along with the meaningful and incentive plan designs that support and encourage participation. The next slide speaks to the wellness programming. There are 4 wellness or incentive plan designs that are a part of the plan. We offer a full menu of integrated wellness activities around those 4 wellness plan designs. They range everywhere from lifestyle challenges to online digital coaching modules, online educational seminars reflecting an array of healthcare topics, and on-site healthy living seminars as well. The incentive programs can be accessed by individuals, and they can work them by themselves or by a group on a team basis. So some healthy competition can be set up at the work site, really supporting a lot of camaraderie and some friendly challenges. RN health coaches are available to assist members with any of these activities, as well as provide a personalized one-to-one coaching experience in order to help that member achieve an identified health goal. Well-structured incentive designs have proven to improve and sustain participation over time, as well as deepen member engagement. And once you have the combination of those 2 things, it really can impact overall medical expense. In addition to all of those wellness activities, we also have an opportunity to integrate the increasingly popular fitness devices. We have integration with 150 plus mobile health devices and apps, everything from monitoring blood sugars and blood pressure right up to the use of Fitbits or Jawbone, where a person can really identify and monitor their own level of fitness and perhaps, access some needed motivation through that process. All of that data can be integrated not only into the portal, but it also can be shared with the primary care physician, and again, offering that holistic view of a member's health status. The next slide speaks briefly to the plan design features. There are 16 medical plans, everything from an opt-in, opt-out, primary care medical home plan or medical plan, a PPO, EPO, and also an option of some high deductible health plans. There are some plans that are available with a 0 deductible. And the focus is on access to primary care. Remember, this is a primary care-led health plan, as well as the use of generic drugs. Other benefits are also available, including vision, dental, other ancillary benefits, short-term disability, FSA, health savings accounts, and so forth, in addition to all of the wellness benefits that are integrated into the plan design. There is an online enrollment and eligibility system that is very easy to use and access, and all of the medical underwriting is done through Healthcare Interactive. Marketing and the sale of Habeo Health is open to all brokers and consultants with clients in the medical systems service area. Again, it's 20 to about 300 employee lives. We like to encourage about 80% of the employee population working or residing in the service area so that there is adequate access to the primary care medical homes. And I'm happy to say that we're expanding the Habeo Health Plan, and we're looking to expanding into the Baltimore-Washington corridor, as well as Philadelphia and Virginia. In closing, and this is the last slide, Habeo Health really offers better care, better health, and better value. We'd like to extend a partnership opportunity to you and ask that you allow us to provide you a quote as the first step to offering your employer groups an innovative and really evolutionary healthcare delivery model. You may have trusted GBMC for your own personal health care, whether you access a primary care physician, a specialist, or maybe have had to use hospital services. And if you're aware of the care that GBMC can apply and how the plan will work to drive performance as it's physician-directed, we ask you to consider that for the employer groups that you work with. It's really fairly easy. We invite you to access the URL listed here and take a tour of the Habeo Health website. There's a great video that Dr. Chazar has put on the website that will really give you a glimpse into the philosophy of the primary care medical home model. If you want a quote, you can click into the Get a Quote section and complete the fields. We're here to help you. If you want, you can send us a census and we'll complete the quote for you and get that back to you. We really look forward to hearing from you. We hope that you'll take advantage of working with us, and we welcome any questions that you may have time. Thank you again for your participation this morning. Erin, I'll go ahead and ask you to let me know if there are any questions that we can answer for our audience.
If there are any questions, please type your questions now. It doesn't look like they're, unless I'm missing them. Oh, wait. Here's one. Okay, it looks like there's one. It says, I'm having a little difficulty seeing it, but can you confirm how an employee in a high deductible health plan would be charged for a PCP visit since the PCPs are directly contracted? And that question is by Tom Carey.
Good morning, Tom. Actually, the costs for primary care services are covered under the contract. So the employee or the member is not charged directly by the primary care physician. It's all a part of the actual health plan. So as long as they access the primary care medical home, it is covered under that plan. And I'm happy to get you some additional information on that as well. Well, again, thank you very much. Go ahead, Erin.
No, I was going to say I think that was the only question.
Okay, thank you.
Let me just double check. Oh, wait, there is one more from Florin Seller. Do you contract with other primary care clinics? I run a primary care clinic in Howard County and would like to discuss.
We're happy to discuss that with you. For the purposes or the way the Habeo Health Plan itself is structured, we are partnering with GBMC and their primary care medical home, their primary care physician panel right now, but we are happy to discuss. As I said earlier, we are expanding. So if you'll please contact me, I will make sure that you have my contact information, and I'm happy to talk with you about that on a sidebar conversation. Thank you for your question.
I do have another question from Henry Franklin, it appears. Is the GBM service area the entire Baltimore metro area, or is it only North Baltimore?
It's the entire Baltimore metro area. And on the website, Henry, I would encourage you to go ahead in. There's a whole list of all of the GBMC primary care medical home sites as well as their locations.
I believe that's the end of the questions.
Okay, thank you. To the audience, thank you so much for participating this morning. I would ask your indulgence to just hang in there for another 30 seconds or so, as there is a brief 5-question survey we'd love to have you complete for us. Thank you again. Have a wonderful Friday.